Welcome back to Medicine Chopped. Mose Wanjiro here, registered clinical officer. Thank you. This is our 6th episode, and we are going to be talking about ANC Clinic, and that's Antenatal Clinic, and we are going to be making calzones. So thank you, welcome, and let's get to it.
Lions roaring in the morning sun, searching for a longer day. People feeling like the light has just come. We must never stop the way. Birds chirping.
Antenatal Clinic, that is the clinic that is usually for pregnant women during the conception and up to the onset of labor. That's when you start visiting your doctor so that they can monitor you, they can give you advices, and if there are any medications needed, they give it to you. So in antenatal clinic, you're supposed to go for a minimum of 4 visits, but there is no maximum limit for your visits. First visit should be before 12 weeks of pregnancy, and in that first visit it usually entails the doctor asking you your personal information, example your name, your mobile number, level of education. That's just personal information. Then there will be something we call the antenatal profile. The antenatal profile includes all the tests that needs to be done, that is going to be monitoring you during the clinic that you have. In that visit, for the first visit, the ANC profile, it usually includes tests like urine test. It involves blood group and rhesus factor. Blood group and rhesus factor are two different things. The rhesus factor is one that usually told that you are O positive or negative. The negative and the positive side, that's what rhesus usually entails. Then there is also malaria tests. There is your sugars test. There is VDRL. VDRL is for syphilis test. Then there is the HIV test. Those are 6 of them. Then there is usually what is it called, hemoglobin test. Hemoglobin, it's your level of blood. If you've ever heard of HB, that's what usually entails. Those were 7 tests. This test is hepatitis B. So those are 8 tests that are done during your first visit. Then there are also some guidance that the doctor will give you about your nutrition, about danger signs. I'll talk more about them. And also the doctor will probably, it won't be easy for the doctor to examine your abdomen. That's because it's less than 20 weeks. From 20 weeks and above, it's easier for the doctor to examine your abdomen, to feel the fetus and all that's entailed when they're examining the abdomen. So the other thing, during the first visit, you're going to be given the iron medication. That is, we usually call it folate. And you're also going to be given folic medication. So these 2 medications are supposed to help you and the baby. I'm going to talk about them more. Then I'm going to attach, at the end of this video, I'm going to attach a table entailing all the visits and what they contain in them. Remember to ask your doctor or your medical provider to provide you with the ANC booklet, and always travel with this book, because you might never know, anything might happen, and it will be necessary for the person who finds you, or for the person who is supposed to help you, to know the information that can help you during any emergency. Then for the second visit, you're supposed to visit it between the 16th week up to the 24th week. And within this visit, you are supposed to get a tetanus jab. And the tetanus jab is given It's usually given on the left hand, on the upper arm. Then the second tetanus injection is usually given a month after the first one, and this is for the mothers who are pregnant for the first time. And after that, it's after every pregnancy you get an injection, or let's say until you get to your 5th injection, if you're fortunate to have that much pregnancies. Then in the visits that are supposed to come after the first one, you're supposed to get follow-ups in regards of drug refill for your iron and the folic medication. The doctor will examine your abdomen, examining for the fetus. Things that the doctor examines for are like the position, that is how the fetus is lying, which part of the body is presenting itself towards the vagina, the fetal heart rate. Also, if you might be having more than 2 fetal heartbeats, so that might indicate maybe multiple pregnancies. Then for me personally, I usually recommend at least one ultrasound, and that is after 20 weeks. This is usually maybe to just deal with the anxiety of the mother, wanting to know how the child doing, what's the gender. But mostly, if you get that a doctor has requested for the ultrasound, it's because there's something that they want to confirm about it. And the recommended number of ultrasound that is supposed to be given during pregnancy is between 3 and 4, not more than that. Then another thing that the doctor might check on your second visit is your HB, and that's in case your HB was a little bit less than it's supposed to be. Your HB is supposed to be between 11 and above. So if it was, let's say, 10 and below, your doctor will keep on doing the HB test. Also, they might request for a urine test again, and that's because, let's say, they saw some infection or some bacteria in your urine from the previous test. In the third visit, it is almost the same as the second visit, and it's supposed to be between your 24th week and your 30th week, and in between this time the doctor will do almost everything that he did in the second time. And also they'll start talking to you about your individual birth plan, and that's your preparedness, what are your plans for transport, where you're going to deliver, everything that entails birth, that is. So on the fourth visit, it's supposed to be between your 30th and up to, let's say, around 38 weeks. So between that time, the doctor will now get deep into the individual birth plan, that is your preparedness. And the doctor will also tell you about the labor signs. They'll educate you on how to breastfeed your child after you've delivered, how to take care of yourself after you've delivered. All these things are done in the fourth visit. So we are going to talk about the danger signs. Danger signs during pregnancy include pervaginal bleeding or spotting, severe headache, severe lower backache and abdominal pains or cramps, dizziness, which is severe vomiting. Severe vomiting, we call it hyperemesis. Also, if you have generalized or swelling, specifically of the face, that it's swollen. For the legs is usually common, so that's usually not much of a danger sign. But if the swelling of the feet, like if you press it and it goes in, that's called pitting. If it pits inside, then that's a danger sign and you should come to the hospital. Also, if you go to the toilet and urinate and see blood or it's painful, that's also a danger sign that you should come to the medical clinic. Then another danger sign, it's if you're seeing blood vision, that is like unaona manyunyunyu ukiona hizo vitu. Another danger sign is reduced fetal movements, and for this, if you're pregnant, it's usually advisable whenever you start feeling that your fetus is moving or started kicking, you should at least have a book where you count the times that the fetus is doing that. And if there's a reduction in your chart, then you come to the hospital. Another danger sign is if you see that your the amniotic fluid is imetoka. When you see that, and what I mean by this is that you'll feel like you've peed on yourself, but you haven't actually gone to the toilet, or you didn't feel like peeing. And it's usually more of, it has a slight color, almost greenish, or it might be clear but sticky instead of how urine usually mostly looks like. Of iron is to provide you with hemoglobin, and hemoglobin is HB, as I said, and this is because your child is sharing your blood as well through the placenta, that is, so you have to supply, because the supply is getting much used compared to when you're not pregnant. The purpose of folic is to help with DNA formation, cell generation, and the child is going through this process, so it helps with that. And this is what usually mostly helps in avoiding defects like spinal bifida, and that's if you see like a child who has hole in their spine, or there is a growth outside their spine, or there are some defects that the child was born with, the folic helps in avoiding such things. Also, there's some other vitamins which are usually necessary that you can get in your main foods, like liver, that is animal proteins, legumes like beans, what can you call them, green grams. Also in vegetables, the green vegetables, kales, spinach. In your fruits, the watermelon, the oranges, all these will provide you with necessary vitamins that will benefit you and the child. These vitamins include zinc, include calcium, include magnesium. All these are needed. There's usually a packet that usually doctors advise for the mother to buy, or you're prescribed for. It usually contains all these vitamins, but you can also find these vitamins in normal foods. The importance of ANC clinic, in summary, is that it tracks the progress of your pregnancy and it also tracks the progress of the fetus. And with this, we try to help in prevention of losing the child. We try to help in danger signs that the mother experiences, so that we can prevent them, or we can act upon them as soon as we get to discover these things. Then during this period of pandemic COVID-19, I urge every woman who is pregnant, please visit your medical centers, as they are using preventive measures to reduce the transmission of COVID-19, and that's through the masks and washing their hands, sanitizing the hospitals. And mostly you'll find that clinics are urging women to come in the early mornings, maybe because of the flow of their patients. And please, as I said, there are 4 minimum visits, so during this time you can avoid all those maximum visits or the many visits to the 4 visits that I've talked about. And unless that you are feeling unwell, that's when you can go to visit the hospital. Thank you very much, and I really hope that all you moms will follow this advice, and I'm congratulating you. Children are very beautiful and wonderful gifts, especially when they're born. They're so cute. For our next video, we are going to be talking about COVID and its relation to the pre-existing conditions, since we have seen a lot of people who we are losing to this pandemic are the ones who have pre-existing conditions. So that's what we're going to be talking about. And this time I'm not going to be telling you what you're going to be make. Let's meet there. See ya.